What happens after the stroke? It may not be possible to prevent a stroke. For survivors, since the stroke caused brain cells to die, it may be difficult to perform certain functions. Some common conditions after stroke include muscle weakness or paralysis, problems with balance or coordination, problems producing speech sounds called dysarthria or apraxia of speech, problems with language called aphasia, like this man who has a hard time finding the right words to say, or like this woman who has a hard time understanding what others are saying. Aphasia can also mean someone has problems reading or writing. After stroke, there may be problems with thinking abilities like attention, memory, and problem solving. These cognitive problems can also make communicating with others very difficult. After stroke, someone may have feeding or swallowing problems called dysphagia. Problems with vision, fatigue, and mood swings, depression, or anxiety. A stroke survivor may experience one of these problems, or they may experience several of these problems. Common conditions will improve the most in the period of time immediately after the stroke. These improvement phases are called acute and subacute recovery. Some problems may still persist and become chronic disabilities. Importantly, this is called the chronic recovery phase, which means that even though problems have persisted, and even though recovery may be slower, recovery of functions can still happen for many, many years after the stroke. To optimize recovery, it is important to work with a team of professionals. Doctors, such as neurologists, physiatrists, primary care physicians, and geriatricians. Rehabilitation professionals, such as speech-language pathologists, occupational therapists, physical therapists, and vocational rehab. Mental health professionals, such as counselors, rehabilitation psychologists, neuropsychologists, and psychiatrists, and people to help navigate recovery, such as patient navigators and social workers. To optimize recovery, it is also important to use available community resources. For example, stroke groups, brain injury groups, and groups that focus on a particular disability, community resource centers, and federal and state human services departments and resources, including disability benefits from Social Security. To optimize recovery, it is important to have the support of family members, friends, and community, and to remember that the impact of stroke extends beyond the survivor, rippling outward to family members or friends who may be serving as care partners. Caring for someone with stroke is often associated with increased strain, burden, and stress. Care partners may have negative changes in their physical activity, social activity, mental health, and their employment and financial stability.